un manque de protection des résidents et du personnel, ainsi qu'un manque d'imputabilité de la part du système. So we've included in this report some stories from families of residents who tried in vain to get the ministry to respond to their concerns about the conditions within the homes that their loved ones were living in. Several of these residents died before anything was done. For example, Peter complained 3 times about the lack of COVID infection control and his mother's worsening conditions at the home, and again after she died. An inspection was not done for 6 months. Rahim complained 3 times about a home's lack of COVID infection control, putting both his parents at risk. His father died and his mother was hospitalized. The ministry to issue an inspection report. We also described some disturbing cases where, based on a review of the inspection reports, homes were not penalized to the extent that they could have been, despite repeated findings of non-compliance. Now, the good news is that in addition to accepting my recommendation, the ministry has already made several improvements. It now has a new policy that provides for training, communications, and PPE across the province in case of a pandemic, and a checklist to follow when it happens. However, there is still work to do. Among other things, it remains to be seen whether inspectors and the ministry will take enforcement action when appropriate. Now, the ministry's goal should always be to confirm that long-term care homes are complying with legislative requirements and to act quickly when they don't. L'objectif du ministère devrait être toujours de vérifier la conformité des foyers de soins de longue durée aux exigences législatives et, dans le négatif, d'agir rapidement. Ensuring the safety of residents and staff must be the primary mission of the branch and reflected in its work culture. It's also crucial that the government strengthen the long-term care sector's ability to respond to crisis by ensuring that there are enough inspectors and by revising legislation to expand the circumstances in which homes must report critical incidents. Homes should not be relieved of their responsibility to properly document resident care, even in emergencies. COVID-19 has not gone away, and it will not be Ontario's last pandemic. I'm hopeful that if my recommendations are implemented and the province remains committed to remembering the lessons from this experience, it will be ready when the next threat arrives. Long-term care staff, residents, their loved ones, and all Ontarians deserve nothing less. Je répondrai maintenant à vos questions. I'd be happy to take your questions now.
This current government cut back on long-term care inspections when they took office in 2018, I believe. Did you find that led to more issues during the pandemic?
So what we found was that the inspection system was already strained before COVID hit, and it had been that way for a long time. There were some homes that were in non-compliance. And so at the core of this investigation is inspections, because to effectively oversee a system, you have to have inspections. You think of the CRA enforcing the Income Tax Act. They do audits, right? And you can't take people's word for how things are being done. And so at the core of the ministry's oversight responsibility is the inspection function. And what we found that it was just not ready for this. It was already strained before the pandemic, but it was not ready. Didn't have a plan, didn't have sufficient people to do those inspections. So they've hired more since then. So what we focused on was the situation from June 20th, or actually March 20th forward. So the beginning of the inspection, the beginning of the pandemic rather.
What was the
action, and people weren't going into the homes for a long period of time. And then when the inspections did resume, some of the homes were let off quite easily. And when you look at the scale of sanctions that could have been imposed, they were often given the least onerous sanctions or given time to fix things rather than really facing tough sanctions.
It was a terrible time, and there was a lot of fear. Were inspectors refusing to go in and expose themselves? Like, what was going on, and did the government allow that?
So yes, some inspectors did refuse to go in, and the union took a stance to try and protect its members, and that's their role. The problem, though, was not the refusal or the actions of the inspectors union. The problem was that the system wasn't there to enable inspections to happen in a safe and effective manner. That's what we're talking about, and that's what we address in the recommendations, is being prepared the next time. So having enough inspectors to go around, having inspectors with training in infection and control, having inspectors that are trained in the use of PPE, and so that they have those protections. They're entitled to a safe workplace too.
So we saw the horrifying stories, and we've heard the horrifying stories of when Canada had to send in, the government had to send in forces. Could that have been avoided if there were proper inspections earlier on?
Well, that's speculation. I can't speculate on that. But what I would hope is going forward that wouldn't have to happen in the future. That if we had a proper inspection regime, you had enough inspectors who were properly trained, that had the PPE, that work with public health units in partnership, those kind of things would not be necessary in the future. That's the hope.
So the alarm bells weren't ringing soon enough because there were no inspectors to send out.
A lot of things were being missed, and we highlight in the report, and I've cited some of those examples. Loved ones were, as you say, it was a terrible time, and a lot of things were being notified to the inspections branch, and what we found was that either they were unable to act or they didn't have a plan to act in a timely manner.
Did you find a difference between the for-profit homes versus the not-for-profit?
We didn't look at that, and what we focused on is inspections, and the inspection regime should be the same for profit or non-profit homes, and so that was not a focus of our investigation.
Were they the same between profit and non-profit homes when it came to how the inspectors responded?
As far as I know, yes. As far as I know, the breakdown of the system, the lack of inspections was across the board, and the problems that we signaled were across the board.
Mr. Dubé, do you think if there had been more inspections that some of the tragedies could have been avoided?
Again, speculation, but you have to wonder, right? Like there were no inspections for 7 weeks. During those 7 weeks, 720 people died in homes. I'm sure that they can't all be attributed to COVID, but you'd like to think that with adequate inspections, with rigorous inspections, with rigorous enforcement of the regulations, that safety would be optimized for residents and staff.
I was curious too about the lack of knowledge just from senior government officials about what was going on. You said this was, in a report you talk about it being limited to pretty much the inspection branch was the only branch of government that seemed to know that this had been paused. So what did the political side know about what was happening in the long-term care homes? Well,
the political side is not the focus of our investigation. We look at administrative issues. We look at sound administration and fairness. And so that was the focus, right, is what the bureaucracy, how the bureaucracy responded, how the bureaucracy was prepared, how the inspections branch. Basically, it's the oversight of the ministry of the inspections function. And, I'll say it again, you can't have effective oversight and enforce compliance with regulations if you don't do adequate inspections. And that's what we saw break down during COVID.
I think you also said, though, that some senior government officials on the bureaucracy side didn't even know that this was going on.
Yeah, so one of the things we call for, and it's in the recommendations, right, that there be more oversight of file management, that managers be more involved, that there are more eyes on these reports, and more people involved in decisions on what the sanctions should be to maximize enforcement.
How did they not know?
Well, there's ways that files were handled and things were kept in isolation at times, I'm sure. So that's what we're calling for, is more transparency, more accountability, and more people involved in the review internally of those files so that the decisions are not made in isolation. And I think that's just sound governance and sound practice.
With winter on the horizon, flu season, expected increase in COVID cases, what recommendations would you like the ministry to address sooner rather than later that they haven't already?
Well, the report is being released today. We don't have the 6-month report back yet. We hear that they're hiring more, that they have hired more inspectors. There's a new law, new rules, but it remains to be seen with what vigor the inspections are carried out and what kind of enforcement is imposed when shortcomings are found. So it's my hope, and that's why we were anxious to get this report out. and get these recommendations and being acted upon, because you're right, winter is coming, COVID is still around, and it's a concern.
We have
I was
heard
wondering
of,
okay, we have heard others detail this real breakdown in inspections, whether it's during the first wave of COVID or continuing today. Like, isn't this stuff that the government should have acted on a long time ago? The COVID has been going on. I mean, it started, this is more than 3 years later.
Well, and we had SARS, right? And there were lessons to be learned from SARS. And I think this is what we focused on when we chose the title for this report. Let's take this opportunity to learn some lessons, right? Let's improve situation. Let's improve preparation so that the next time a pandemic hits, the province is more prepared in long-term care to handle it, to keep residents safe, to keep staff safe, and to keep death and illness to a minimum.
your report talks about dehydration and neglect and malnutrition at times. Did you ever find proof that this happened in any of the homes, residents dying not necessarily because of COVID? But
So I don't have oversight of long-term care, right? I have oversight of the ministry. So the patient ombudsman looked into the patient experience, or the resident experience, if you will. So that was not within the purview of our review. So what we focused on was how well the ministry, through its inspections, was overseeing long-term care, and were they doing enough to protect the health and safety of residents and staff. And so the answer was no. The conclusion that we came to was no. And for the reasons I cited, that there was no plan to conduct inspections when a pandemic hit. Inspectors stopped inspecting for long periods of time. They feared for their own safety, understandably. There was a lack of PPE available to them. They didn't have the training in infection prevention and control. And there was a discord, and one of the things we recommend is there should be more collaboration with public health. And then when inspections were done, some of the homes that had violations were not very seriously or sanctioned very severely in the way they could have. So I think that all of those things will improve the system, will improve the inspections regime, will improve the oversight of the ministry, and we're hopeful that that would lead to better, more health and safety, better outcomes in the
there was
future.
a ministry inspection specifically called when the Canadian Armed Forces, parts of the reports outlining dehydration and neglect deaths at 2 homes in particular. And then the ministry then went and conducted an investigation into those and those reports from the Canadian Armed Forces. This happened way after the first wave. I was wondering if your report, I don't see it in here, but did you look at that inspection that they did?
Well, we looked at all the files that we could during that period of time. I have to say that the Canadian Armed Forces didn't really issue a report, right? They sent a letter, an internal letter, and one of the things we found was that they did not communicate to the ministry in an effective way all of their findings, right? That is required under the legislation. So the Canadian Armed Forces weren't really briefed, and but we did look at that and we reviewed that. That was actually the impetus for launching this investigation when we read those accounts. Some of those accounts have been sort of retracted to a degree. They were based on opinion and not necessarily evidence. So, but it was an important catalyst for us to launch this investigation, definitely.
On something entirely different, there's a bit in here about the decision to launch a new computer program that delayed the issuing of reports to homes. I was wondering if you could elaborate on that, because that seems a remarkable thing to do in the middle of a massive crisis.
Well, work doesn't stop when the pandemic hits. You rearrange your priorities, you reorder your priorities. But I think that if the determination was made that better IT support or new system would enhance things, the work it was decided that the work on that would continue. So I think that was an effort to improve the system.
Is that what delayed, though, issuing reports to long-term care homes for months? That's what the report seems to say.
Well, I can't pin it all to that. I mean, the lack of inspections resulted in a lack of reports, right? That was the most important thing.
You mentioned that there was no PPE for inspectors. Is that not a government responsibility? I know there was a shortage of PPE, but was there a lack of awareness of what was necessary in these long-term care homes to protect inspectors and staff? Were all the resources going to hospitals instead, for example?
Well, I don't know how resources were diverted. I just know that the plan was lacking. The plan to continue to conduct inspections during a pandemic was lacking. There were no guidelines on how, when, and where to do it, and how to equip inspectors, to how to ensure that they were properly trained. And those are the things that we address in our recommendations.
Was there even an attempt by the government to coordinate one during that time? That you
Well,
saw?
I don't know. I can't speak to that. I don't know. I don't know the answer to that question.
When you were mentioning earlier that a lot of times the reprimand or at least guidance or enforcement that would have been done was a lot of times the least of any reprimand, to the point where it seemed to be key messaging was being relayed by phone instead, because that seems that was the best could be done. But when you were looking, did you see any time where this leniency was potentially given because of the staff themselves being overwhelmed, and it not necessarily, and more so, I don't know if empathy is the right word, but they were. This was, as Cynthia mentioned, it was a very confusing and very fearful time.
Absolutely. Look, I can't speculate. I can't speculate on people's motivations. We just look at the evidence. What the evidence that we saw when we looked through inspection reports was that when you matched up the problems that were found and the issues and the risks that were identified, and you looked at the sanctions or the enforcement action that was taken, it was pretty low on the scale of what could have been, and it raised questions of whether it was at the appropriate level. But I can't speak to people's motivations or what their thought process was.
Was there ever a time where you thought, looking back, there should have been an occasion where that, I believe at the beginning, it was in the executive summary you were mentioning, just the nth degree that you could go to about having essentially not the charter be put in someone else's name, but someone else would be put in for managerial purposes? Did you ever see a time where that could have been warranted?
Well, I think I can't speak to that either, but what I can tell you is that the transition from inspection role to kind of a support role was not really serving the interest of residents and staff. That I don't think that optimized safety, right? Calling people on the phone and asking how things were, and then offering support to the homes by phone, that's not really an effective oversight role, and so we found that to be problematic. Okay. All right. Thank you very much, everybody. Appreciate your interest in this.
Chelsea.
In 2015, from 2015, 20. Oh yeah, thanks. Sorry, I should have waited for you. I'd just like to thank the Ombudsman for his report and his recommendations. That very clearly that we need to learn the lessons from the pandemic and what happened pre-pandemic. That caused the problems that we saw in long-term care. And
So John, the ombudsman didn't make a direct link between the lack of inspections before the pandemic and what happened with inspections during the pandemic. Do you think it's fair to make any link between those?
I think it's fair. In 2015, 2016, 2017, almost all homes received a comprehensive RQI inspection. In 2018, it was about half, and that was because government, they were trying to focus on, who are the outliers, who are the worst performers, instead of doing everybody. Then in 2019, only 9 out of 626 homes received a full comprehensive inspection. That's a big drop. There's also been a persistent challenge with the enforcement, not the enforcement piece, the penalty piece, what actually happens. And it hasn't, in some cases, and we've seen in reports, changed the behavior of what's happening inside long-term care homes. And the industry itself, the private industry, has lobbied very, very hard to reduce the number of inspections. And that's not good. It's not good for residents. It contributed to what happened here. Is it solely the reason that we had the problems we had in long-term care? No, but it didn't put us in a good position to be able to be ready when something happened that we weren't ready for. I mean, there were other problems in the pandemic, like it took, a month longer than other provinces to decide to pay people more and only have them work in one home. It took us 6 weeks longer to get a vaccine into long-term care than it did in other provinces. We were vaccinating hospitals. So there were other problems that really impacted long-term care. And, everybody was concerned about the risks during the pandemic. Well, there are PSWs that went in there every day, nurses that went in there every day, doctors that went in there every day, administrative people that went in there every day. I think it would be appropriate for inspectors to go in there every day. And if we're going to have people taking risks, then the people who are helping them do their jobs better need to take those risks as well too. That's one thing that I would like to see. I haven't gone through all the recommendations. I don't know if that what the Ombudsman has asked for.
Do you think the government, the minister, should have known that these inspections essentially weren't happening for 2 months?
I think it was a time where it was very busy. I think what happened was the inspection regime, the regime of inspections had been changed, fundamentally changed, dropped. And then it was just things, you had this thing where you get only 9 out of 626 receive a full inspection at the end of that year. And then within 3 months, we're in a pandemic. So how could we be ready? Right? Could we be ready in those homes if we're not even, we're not even getting the basics right by doing a quality inspection, helping people get it right. That's what inspectors are there to do. Like enforcement is a big part of it when you don't get compliance. But really what you want to go in and not have to find people non-compliant, right? That's the point. And it was a wrong approach to reduce comprehensive inspections, essentially almost eliminate them. And again, there were a lot more things that happened. It wasn't just the inspection process. I think if we take a look at government decision making and the timeliness during a pandemic of things like raising people's wages and isolating them to get them to work in one home and getting vaccines to people who needed them. So other provinces seemed to be able to get in long-term care, and we were vaccinating people in hospitals. And the people in long-term care are most at risk. And so we're not, it's not popular to say this, we're not out of this pandemic yet. So in our long-term care homes, there's a long-term care home in my riding that my father-in-law used to be at, that I still get a family council update. So they have 5 units on outbreak right now. 4 of them are COVID, and other one's rhinovirus. And so we got to get this right, because it's going to be with us for a while. And flu, it seems a flu outbreak. So we have to make sure that people have the necessary tools to keep residents in long-term care safe. And that's why the Ombudsman's recommendations are so important. Excellent, thank you very much.